Namaskar, I'm Ashok Vyas, and you are joining a very special weekly session with Padma Shri Dr. Sudhir Parikh. And this week, a lot has happened. Let us begin, Dr. Saab, first by welcoming you and thanking you for joining us. Namaste. And,
Namaskar.
and we go to India first with you and try to see as a physician as well as someone who is closely following all the developments of India, the extension of quarantine days up to 3rd May as announced by Prime Minister Narendra Modi ji. How do you look at that?
Well, I think it is absolutely necessary because right now we are in India, we are between phase 2 and phase 3. So till the phase 3 is over, quarantine has to be there. And I think what Prime Minister has done, it's really most critical and essential to do this kind of quarantine, to keep the number of cases down and number of sick patients down.
Continuing with the Indian condition so far in terms of the way different political leaders have responded to the need of the hour. How do you look at the kind of understanding which is being displayed, I think, by um, different political leaders from all the parties, more or less?
I think in this pandemic, it's a real crisis. It's a real emergency, and I can see that all the politicians, regardless of their thinking or regardless of their political disagreement for other issues, in this issue, I think everyone is together because this is a question of life and death of the thousands of people.
And there is a world body called World Health Organization. I think there was someone from WHO in India also who also talked highly about the preemptive measures initiated by Prime Minister Narendra Modi. But of late, there has been a lot of question marks about the overall effective working of WHO. How do you look at the role of WHO, especially in the context of this pandemic?
Well, I mean, WHO is a very important body of United Nations. WHO has done so many. WHO has tackled so many this kind of health crises, including Ebola and SARC and bird flu and so forth, and HIV infection crisis in 80s. And so WHO is very important, and I think WHO has some shortcoming because in this particular pandemic, I think they were kind of little late for alerting the world. If they could have done little earlier and could not have a little glossified Chinese opaqueness, then I think the results in the throughout the world would be different.
But now at this hour, when we are in the middle of, we meaning as a world body, are in the middle of this pandemic, uh, whether there are some shortcomings or not, do you see that restricting the support, financial support of $400 million to WHO by President Trump, it makes sense to you, or do you see differently?
No, it doesn't make sense at all. And I think Trump is incorrect or wrong because in the middle of the pandemic, he should not have done this thing because we need WHO. And whatever question or postmortem you want to do about who did what can be done once pandemic is over.
So I hear you, and there in the press conferences conducted by President, one gets an impression that there is a sense of urgency in reopening America. But the timeline, can it be decided given the situation that we have? If we look at the number of human lives we have lost in New York itself, and there is no end in sight so far.
Well, scientific, no, the timeline or when to open, it all depends upon on the science, on the data, health data or scientific data. And right now, as of even as latest by this morning, Governor Como is showing that the curve is flattening. Number of admissions to the hospital are less. Number of ICU admissions are less, and number of discharge from the hospital are more. And he showed the graph very nicely, and it looks like New York, New Jersey, tri-state area has plateaued, and slowly it will come down for the next couple of weeks. And that's how usually this kind of viral epidemic or pandemic behaves. And only thing is that most important thing is the if at all if you open the if you do the opening of the of the country, then because see the every state has different impact of this virus, right? New York, New Jersey, tri-state has maximum, and then West Coast has maximum, then Detroit, Michigan, and Illinois has a lot, and Louisiana has a lot. But if you look at North Dakota, South Dakota, or Nebraska, there is not much impact. So only way to open up this thing is while opening up has to be kind of rolling opening up. It means opening up with the only certain essential services, with the all guidelines in place, like social distancing, not together more than 5 people or 10 people. The restaurants and bars should be right now should not be open, just like what India did. All the sports arena or theaters, all should be closed. No wedding, no birthday party should be done. So no gathering more than 5 people, and continue to maintain the social distance. And when you go out in the public, everybody should wear the mask. That way you can minimize. And then the most critical thing is testing, isolation, tracing, and isolation. It means we must continue doing testing, and those who are positive, you remove from the them from the circulation, trace their contact, test those contacts, and remove. And if they are positive, remove them from the circulation. So by doing that, definitely the rate of infection will go down. And because see, you cannot continue to completely lock down whole thing, including economy, because economy has to come back slowly. Otherwise, there will be a kind of depression, and lots of then the effect will be much, because virus will go away. Of course, it will come back in the winter time. And real answer is to vaccine, but vaccine is almost 12 to 8 months away. So till then, we have to do certain in step by step opening, with all the other guidance or guidelines should be in the place, and it should be strictly enforced. If there is a violation, then it should be punished, and that's the only way to open the society. But good news is that the curve is flattening. Admissions are less, ICU admissions are less, and as you can see that even Javits Center and that big Navy ship is still empty. It means they're hardly 20% used. That shows that it's a good news. And that shows that number of critical ill patients are getting less. And now probably another week or two, you will see that number of new cases will be less. Still, there new cases are there. New cases in a sense that the one who are positive, more positive, because as you do more testing, you will get more positive cases. So if you keep doing another say million tests every day or every other day, or then of course out of that 10% or 20-15% may come positive. So you may think that is going up, but you have to see that whether cases are doubling every three days or every 8 days or every 10 days. As long as if it doubles every 10 days or 15 days, then the worry should be, scientifically speaking, the concern should be little less. But of course, you cannot open up as like nicely somebody said that like a switch of the light, that on and off. You cannot do that. You have to do phase wise, you stepwise, and you have to do only with the essential services. And then after essential services, after a week or two, then you can do little more and more and more, and that's how you have to keep going, because until some medication or treatment develops the chances that treatment will develop within next 3 to 4 months, because like plasma therapy or some drugs. So if it does happen, because right now a lot of studies are going on in all the hospitals of the country where all the sick patients are there. So hopefully, if once we have treatment, and then later on once we have vaccine, everybody will feel more comfortable to go out in the society, and try to come back to normal. But this normal will be different normal than what we are used to normal.
So this different normal, we will still be welcoming, at least away from these days of quarantine when everybody seems to be restricted to their home. Uh, as we move towards the concluding part of our conversation, Dr. Sudhir Parikh ji, Indian American community has also risen to the challenge, be it medical fraternity or philanthropists, and be it media. They have done their bit. What would you say about the role that Indian American community has already played, and what would you like to see in future in terms of various steps to counter this challenge brought at our doorsteps by coronavirus? Uh, Indian Americans serving here or helping the situation in India?
Well, right now, Indian American community, particularly our physician fraternity, are doing extremely good work. They are trying to. We all are in the front line anyway. As a myself or my colleague or my friends, they are really sacrificing their own well-being to help the COVID patients. Number two, we also Global Physician of Indian Origin and American Association of the Physician of Indian Origin. They are doing a lot of video conferences, lot of meetings to educate the community at large. What is COVID virus? How one should behave? What are the misunderstanding of the whole illness or pandemic? And they are educating the whole community at large. And also, we are raising a lot of fund, and part of the fund goes to the needy people here in our community, as well as to the help the frontline physicians who has some needs some help for personal protection equipment. And also we are sending a large amount of the fund to the Prime Minister's Care Fund in India to help our Indian brothers and sisters in this horrific pandemic.
Thank you very much, Dr. Sudhir Parikh ji. And as we say bye bye from this show, your concluding remarks or message for our viewers.
Well, I mean, dear friends, this is very serious pandemic. You must uh, stay home as much as you can. Even if you go out, you must wear the mask all the time. Do not congregate more than 2 or 3 people at a time. keep the social distance, and always keep the personal hygiene up to the best mark. Keep washing your hands. Do not touch the open or unbarren or barren surfaces. And these are the things which can get you into trouble. So be careful, be safe, be healthy. Jai Hind. God bless America. God bless India. Thank you.